Good morning, Chastity. How are you
Good
doing
morning.
today?
I'm great. How are you?
Doing well. Thank you so much for hopping on with me this morning. I appreciate it.
Mm.
Um, we chatted before this call, of course, but I would love for you to talk to me a little bit more about your previous work history and what you've done throughout your career.
Well, I started my career in respiratory therapy, and I was fortunate enough to be able to work with all age groups. I started my career in trauma, and I was able to work my way into several areas of the hospital, specifically dealing with, litany of different health issues. And then I went into respiratory education, and I started developing and helping other respiratory programs with accreditation and getting them rolling and getting the students and accessing clinical affiliates. Um, Throughout that whole time, I was able to obtain my bachelor's in Cardiopulmonary Science, which is an advanced respiratory degree. It also goes into neonate and pediatric respiratory care, which I dealt a lot with that demographic throughout my years as a respiratory therapist. And then I went into education full time, accepting a job in the Caribbean as a vice principal of an international American school, and helped underprivileged children in those communities be able to graduate with dual high school diplomas to be able to immigrate to the US to go to college and help their families and progress and possibly also immigrate to the United States. So I've been also teaching science at the middle school, high school level, and I was most recently a director of enrichment at a private school, which was K through 12, which involved all children from ages 5 all the way up through the middle school, engage in after school enrichment activities um, that dealt with anything from robotics to art to drama and theater. So all these programs included the whole school campus, age 5 through about 13, 14 years old. And I directed the whole program, created the whole program actually, and was able to staff for it. And was able to really be involved in that. Most recently, a respiratory therapist again in the state of Utah at a community hospital, which served infants all the way through geriatric age. So I dealt with infants and children of all ages on a daily basis at that job.
Awesome. Perfect. And moving into your next position, what's important to you?
The most important thing to me, I think, is to be able to continue to grow professionally, personally. I feel that I am able to contribute skills, but I also feel there's always an opportunity to learn and expand on the things that I think that I may have a grasp on, or open my area of expertise into more things and just learn more things. I'm all about the learning process. I'm very much involved in continuing my education credits and units that allow me to continually expand my knowledge, incorporate new ideas and new ways of doing things, and just continually expanding on my base knowledge and more.
Perfect. Awesome. All right. Well, Chastity, thank you so much for meeting with me and being so thorough with your previous experience. It's great. So I will be in touch with you and we'll chat a little bit after this call.
I appreciate it. Thank you so much.
Thank you.